big font because it's hard to read. Double space it, put it in a paragraph. What's a paragraph? A paragraph has an indentation. What else does it have? A couple of sentences. I'm not going to be like your third grade teacher that said, if you don't have 3 sentences, it's not a paragraph. But one thing a paragraph does have, it's all about the same topic. Like it has a statement, and then it has supporting evidence below it, right? And summary maybe of the paragraph, okay? In other words, don't put the whole response into one paragraph. That is not correct. And it's really hard to read, especially when it's single-spaced in a really small font. When I look at it, I think to myself, holy smoke, I can't do it. Okay? Just be cognizant of your reader a little bit, okay? Another thing, and this is just a habit that you need to get into as an adult, writing as a professional person, subject-verb agreement. So if your subject's single, your verb's single. You and they and I don't belong in the same sentence because they don't go together. Okay, make sure you pay attention to that a little bit. And then proofread when you're done to see if it really says what you think it says. Just saying, okay? I'm not scolding. I'm just trying to help you for the future. Because most of the assignments are going to require formal writing. I don't want APA format. I don't need resources in APA style format. I don't need any of that. I just want you to not write to me like you're sending me a text. Because it's not the same. Okay? And then the other thing, after you get done formatting it, please answer the question specifically. Answer the question specifically. Don't give me a bunch of sparkling generalities of what you think I want to hear from you. I want your opinion in most of these assignments. But I want it in a well thought out manner so that we could have a discussion about that. Okay? So specifics, details. The specifics, that's the details in the paragraph, right? If you're having trouble with the paragraph, perhaps it's because you need some specifics. And then, like I said, proofread. Did you answer the question? Did you format it like a college level assignment and then proofread it? Okay? It's still only going to take you a few minutes after you've done the homework. However, if you have not done the homework, you will not be able to do those 3 things well. You'll give me all those sparkling generalities that you think the VARC was about. Okay? That's all. That's all about that. Are you done with this? Everybody got it?
200 on your Zoom, just remind me.
Is that what I had?
Yes.
Oh, that's big. Okay. Let's put that down. This up. Nope, that's not what I want. Yay, I did it. Write that down. Better get the date on it. So, with Bloom's taxonomy in mind, we need to think about how your specific learning style can apply to that. And that's kind of what we talked about before. How are you going to use your specific learning style to apply, to help you to understand, not memorize, okay? And to move up to another level above that. ugly things now. Okay. So, think for a second about getting ready for class, all right? Whether it's nursing judgment or whatever class it is. And that, some of you are still in A&P, some of you are just working on the nursing classes, or some of you have micro. But how do you prepare for class? What are some things that you do? Throw them out. Read. That's how you start? Is that your strong suit? Okay. What else do you do? What?
Learn vocab.
Learn vocab. You pull out the vocab. Okay. What else? Take notes. Where do you get your notes? From your book. So you're reading and writing at the same time. What else? You make flashcards. Okay. What else? What? Draw diagrams. Yeah, you visual people. Draw diagrams. What else?
Talk with others.
Talk about it. Do you ever read out loud? Did you ever read out loud to yourself? Did you ever have somebody say to you, "No, you read"? Why were you doing that? Because you're reading. Because you wanted to hear it. You did. You really did want to hear it. Did you ever do that when you were? Did you ever do this? Don't lip read. Why were you doing that? Well, when you lip reading, you're not really hearing it. But you know what you are doing?
Doing it.
Doing it. What else do you do? When you don't understand the vocab, what are you doing?
Yeah.
When you don't understand the concept that you're talking about, what are you doing? I will think about where? Google or oh yeah, Siri's smart, isn't she? Just Google it. I Google stuff all the time. Siri's so smart. Sometimes she hacks me off, like gives you the wrong directions and gets you in the wrong places. But we do it all the time. Okay? We didn't used to have that. Right? Like when you wanted to look something up, research something, when I was in school, you had to go to the flippin' library. And then the library didn't have what you needed. You guys are lucky. All you gotta do is and you're good. Siri's got 50 sources for you. Okay? You do it. You find it. Get the mirror out and look at the person responsible for your learning. You. Okay? We are going to give you as many modalities as we can, but we can't be responsible for your learning. Okay? What do you do in class to help you learn? In class?
Yeah.
Respond, right? What else?
Ask.
What? Ask questions. What else? Take notes. What else? Throw it out.
Active listening.
Active listening, what's that?
You listen and like process it.
What do you do to process? There's no right or wrong, right? It's what you do. What do you do to process?
Just think about applying it to your life.
Picture yourself doing it, right? That's what you guys are doing, you kinesthetic people. Picturing yourself in the situation, right? I try to use stories all the time. My family is used to this because they all get into part of the story. And I've had students tell me they love stories, and I've had students tell me they hate stories because they take time. But the reason I give you stories is because you remember stories. Okay? And you remember the point of the story. Okay? What do you do after class to help you learn? After class.
Review.
How do you do that?
Review what you put, the notes you've taken.
You look at your notes. What else?
Watch the video I recorded.
Watch the video that was recorded. Okay, what else? You mean like Bloom's taxonomy that I couldn't figure out?
No, actual recording.
So you record it. Okay, what else? Anybody else? Rewrite your notes? Discuss it with your peers? What else? Anybody else? Okay, so active learning starts with a plan. Write this down. For every hour in class, you should be spending how many hours studying? 3. 3. It's 1 to 3. This is a 2-hour class. 2-hour class. That's how many hours? 6. How many hours are you in class a week? 11. How many hours is that of studying? 33. Altogether, that makes how many? 44. How many hours are you working? How many? 40. That's how many hours altogether? That's over 80. How many hours are you spending with your family? How many hours are you spending on meal preparation, cleanup, shopping, laundry, getting your kids back and forth to school, driving home and to class, watching TV, etc., etc., etc. Forget the TV. You don't have a life until nursing school is over. Just make a decision. Is it worth it? How many hours do I need? And then make yourself a picture. However your learning style says you need it. However that learning style says, but look at it. Or discuss it with your family. Or make a plan that accounts for all of your time. Because your success depends on that. It really does. And if you get behind now, you're going to regret it later. All right? Go to the next one here. So, let's talk about priorities. Where did your priorities lie? You don't have to tell me, but you do have to come to grips with this. I have had students. I used to have students make a chart, like you were 10, you know, and you had a chart that your mom made to make sure you did all your chores at home. Some of you probably had that, some didn't. Okay, I used to have you make that and turn it into me and sign it. Because on that chart, I made you put in where you were going to put that 3 hours of studying for every hour you are in class. Because if you don't plan for it, you won't do it. And other stuff will crowd it out. Or you'll crowd it out until midnight. I saw what time some of you posted your ticket to class. I had people posting at midnight and 1 o'clock in the morning. When you're getting up for clinicals at quarter to, and have to be at the clinical at a quarter till 6 in the morning, won't work. You can do it for a while. How many hours do you have to work? Make a plan for that. Maybe somebody's going to have to pick up some slack for you somewhere else to make it work. Maybe somebody else is going to have to pick up your kid. Maybe somebody else is going to have to shop the groceries. But make a plan for it. And then you better make a backup for it. Because if you don't take care of these things and place your priorities in the right place, pretty soon you'll get sick because you didn't eat right, you didn't sleep right, and you get behind, and then your life gets ugly, and your family doesn't understand why your priorities have changed. You've got to have this conversation. You've got to make it priorities. This is reality. This is going to be survival. It's only for 2 years. years seems like a long time right now, but it's not that long. Just saying. Priorities. What is your highest priority? What is it you have to do? You have to eat, you have to sleep, you have to study, you have to make sure your kids are fed and dressed. But beyond that, what do you have to do? What should you do? You should shower. But you know what? You have to shower? No, you can survive. Okay? Just saying.
I shouldn't cut and get disinfected.
Yeah, I know, but you should. You should. And then what would it be nice if you could do if you had time? That is not where the studying goes. Okay? Just saying. Nurses do the same thing on the job. The very same thing. If you can't prioritize your personal life, you will suck at prioritizing your nursing life. Because it's about what you must do, what you should do, and what it would be nice to do. So you're the nurse and you come on in the morning and you got this list of tasks for the day. How are you going to prioritize it? Are you going to start at one end of the hall and go to the other end of the hall? Well, that might work and it might not. Remember, we talked about priorities last week, and we talked about how A, B, C, pain, and safety, right? What else did we say?
Educate.
What?
Educate.
Educate. It's the same thing. A, you must do A. You must. You must have an airway. If you don't, nothing else matters. B, are they breathing? Absolutely, or nothing else matters. C, do they have circulation going? Absolutely, or it's a very short life. It's the same thing. Prioritization is key to surviving. Okay? And your book talks about that. It talks about using time constraints to help set you priorities. It talks about urgency factors. It talks about whether it's acute, that's urgent, or non-acute. It's not so urgent. Education can wait if your patient can't breathe. Education can wait if your patient's in pain because they're not going to listen to you. Okay? It's really a good thing to educate. But is it above the other priorities? Okay? Same thing for the nurse. If you got 3 patients, which one of them is your priority? You got to set your priority. Okay? Y'all watched MASH before? It's an oldie show, right? But you've all watched MASH. What do they always have to do? Triage, right? We do triage in every disaster. Why do we triage? What's triage?
Prioritizing.
It's prioritizing. That's all it is. Only in this case, what are we prioritizing? Which patient we're going to spend time on. And which order they're going to get covered. Y'all watched MASH before, right? When they triage, what do they have to consider?
If they're gonna live or not.
Number 1, can we save them? Now, if there's a possibility, that's the first person we're going to, right? And if they're dead already, they're not going very high on the list. You all seen that before, right? In the old westerns, and they get gut shot. Well, there's not much I can do for you, kid. Right? It's still a priority situation. Triage. Acute, not acute. What do we need to do first? Which patient is most important? Which one has to have our first attention? And that's what your book is talking about when it's talking about prioritization, right? Let's talk about NCLEX question for a minute. Every NCLEX question has the same design to it. It starts with a stem. We call it a stem. And the stem is just the situation that they're giving to you. And they always give you a situation with a little bit of patient information in it. Read the stem carefully. Number one, identify the stem. Okay? Do not include stuff in the stem that is not there. Don't read into that stem. The stem is what they give you. Then they give you a question. And what is the question they are really asking you? Don't read into it. What is the specific question? The stem, that's the situation, and the question. Then, if it's a multiple choice question, they're going to give you a bunch of distractors, and they're going to give you one correct answer. The distractors might be partially true. They might be all true but one little thing. They might be totally false. And they may have some weird information that wasn't really in your question or your stem. They're distractors. Like the guy washing the window. We want the window clean. We like the window clean. But our focus went there instead of what we were talking about. Because it was a distractor. Same thing with a false answer or partially true answer. Okay? Sometimes you'll get a question that is a select all that applies. Students love those. Okay? Because there might be two or more correct answers. And you only get the question right if you get it all right. So you might get one of them, but not the other one. Question's wrong. Because that's what NCLEX does. They do not give you partial credit. It's either right or it's wrong. So I'm going to talk a little bit about how to get through those kinds of questions. Sometimes you'll get true-false questions. Sometimes you'll get questions that are, they're actually experimenting with some fill-in-the-blank kind of questions, but so far they're not counting those. So if you get those in NCLEX, they won't be actually giving you points for those, they test them. NCLEX always has a portion of the test that is questions that don't count, because they have to check out the questions and norm them. That means that they're checking them out to see how many students miss them, how many get them right, which distractors they're getting lost on. It's a research part of the NCLEX test, and they're always researching new questions, okay? So you get to be their guinea pig on some questions. Right now, the fill-in-the-blank questions are like that. They're also experimenting with some where you click on certain things in the picture. Those are still experimental questions. So they're messing with some new kinds of questions, but so far they're not actually using them. Okay, so I'm going to throw this question to you. All right? We have a competent elderly client admitted to the emergency department with an MI, and he declines treatment and wishes to be an elderly client, competent elderly client admitted to the ED with an MI, declines treatment and wishes to be discharged home. Which statement best supports the client's right to refuse care? What's the stem?
And he's an elderly client that was admitted into the emergency department with an MI.
Is it a he?
No.
No, you read that in, didn't you? Because I read that in. We don't know it's a he or a she. It's an elderly client. Okay, and they're competent. They're not confused. They're competent. What is the query or the question?
What best supports the client's right to refuse?
Okay, the word best. What is the best support to the right to refuse? Okay. Now we have the choices. I have lived a full life. I want to go home and die. I understand that without treatment I could die. It's too expensive to stay in the hospital. My family wants me to go home. I'll be okay. Okay, tell me about response number 1. Just tell me about the response.
kind of dramatic.
Totally dramatic. What else?
Could indicate that he's depressed, you know. Like,
It could.
just wanna go home and die.
Does it support his right to refuse?
No, because he might not understand.
He's competent.
It does.
It does. It does. It does support his right to refuse. I can go home and die. Not die, but I can go home and die. I've lived a good life. I can go home and die. It does support his right to refuse. Okay? Let's look at number 2. I understand that without treatment I could die.
He's not really refusing, he's just saying that he understands he can die without treatment.
That is correct.
Supports the-
Does it support his right to refuse care? That's the question. Does it support his right to refuse care? Yes, it does. Is it a better response than number 1? Absolutely. Because we don't know that he's going to die, but we do need to know the best support for his right to refuse. And number 2 is a better answer to his right to refuse. It's too expensive to stay in the hospital.
Well, look, sign it in your papers, it's gonna be more expensive.
Doesn't have to choose between cost and his right to stay in hospital. That's not what this is about. That's not about his right to refuse. That's about cost. And he shouldn't have to deal with cost as to whether or not to stay there. Okay? My family wants me to go home, I'll be okay. That might not even be true. That might not even be true at all. And it's certainly not about his right to refuse. It's about his family, and he might not be okay. So do you see how the thought process has to go through that? Just one question. Look at your stem, the situation, and then see what question they're asking. Once you've picked the best support for his right to refuse, okay, we had 2 possible answers. One was better than the other. Why?
Shows that he's been educated.
True. That is true.
Mine was dramatic.
True.
Sounds like the most competent current.
It is the most competent. And what about I've lived a full life? We don't know. But when he says, I understand, you have educated, he is competent, and he says, I understand that without treatment I could die. That's his right to refuse. That's what the question was. Look at the question. So NCLEX test-taking strategies, okay, or SATA, which stands for Select All That Apply, okay? Okay, now we're going to talk about the Select All That Apply question. There are usually 3 different types of Select All That Apply questions, okay? We put them all into a pyramid format for you visual people that like visual things. If you think of it as a pyramid, okay, well, you start at the bottom, okay? Cover all the answers. Look at your stem. Cover all the answers. Look at your stem. Read it carefully. Then look at your query or your question and say, what are they asking here? What is it asking? Okay. Now we're going to look at each answer one at a time, individually, not at the whole list, because that's overwhelming. And it gives you too many thoughts swirling around from here to there all over the place. We want to keep our ducks in the row if we can. Okay. So start with the first answer and evaluate it individually. And then, as you're evaluating that single answer, say to yourself, is that one answer completely true, or is it completely false? Completely. And then, does it apply to the STEM? Does that make sense? Okay, it sounds really easy, doesn't it? Okay, so let's try it. Okay, cover it all up. Don't look at all of it. Just look at the STEM. The client has grown very fond of the nurse. The client is very fond of the nurse. That's our situation. Which items may the nurse accept from the client? Okay, number one, only look at number one. A token gift from the client to the individual nurse. Yes or no?
No.
We don't know what a token gift is, do we? Can the nurse accept a token gift? Probably not. It's an individual gift. Okay? So we're not going to pick that one. That's what you're telling me?
Right.
Number two, the client's permission to be a contact on a social networking site.
Yes.
No.
Well, nobody probably know, but is it a good idea? It's kind of beyond professional boundaries, right? You're there as a professional.
Wouldn't it fall under kind of like HIPAA too?
Could be. Could be. Could certainly cross the line with very little trouble. Okay. So, can the nurse accept that from the client? That's the question. Not really. It's not professional. Okay, let's look at number three. A position as a private duty nurse for the client upon the client's discharge. Okay, the client's grown very fond of the nurse. Which item can you accept from the client? Your discharge. After you discharge, can you do that?
You could.
You
Yeah.
could, but have you discharged?
No.
No. So we don't know that.
Okay.
That's reading it into the STEM, right? We don't know that yet. And you haven't discharged yet. So I'd leave that one alone. It's kind of beyond professional boundaries at this time. Not to say that 6 months from now and you're no longer working at the hospital, you couldn't take that job. But right now, professional boundaries. You haven't discharged yet. That's reading into the STEM. Okay, let's look at 4. A hug from a client upon discharge.
Sure.
But they haven't discharged yet.
True. Can you do a hug from the client? Maybe.
Yeah.
As long as it doesn't get to be like inappropriate, right? So that's a boundary. It is really a boundary. Kind of depends if that's an 8-year-old or, what it is for sure. Okay. So that's a possibility. How about number 5? A thank you basket of candy and fruit from the client for the unit staff.
Unit staff.
Absolutely. Absolutely. So we know we can do 5. And we probably could do 4. But I wouldn't go any further than that. You have to read the STEM carefully. You have to ask the question. A hug from the client upon discharge. Maybe.
I feel like if we're throwing out 3, then we have to throw out 4 then.
I know, I kind of agree with you.
I feel that, yeah, I feel that.
I agree with you.
Do they do this where they say select all that apply and they only have one? That's the right answer.
Sometimes.
Because before
Okay.
you have that.
It's
I know. I'm telling you guys, I'm not telling you that these are all the right answers. Right now we're learning how to look at the question and how to look at the answer. And trust me, the first nursing test you take will be a blood test. Because you don't think this way yet. You will. The more practice tested questions you do, the better you're gonna think.
But so that two or more set in stone.
There might be all correct. They might not any, they might have only one or two. I know, but I'm just telling you. Don't choose a messenger. It could. Let's look at another one. This'll blow your mind. The nurse is working in a busy ED with multiple admissions. That's why it's annoying. For which client should the nurse ensure mandatory reporting is completed? Okay, select all that apply. A client who has a gunshot wound. Okay, what's the stem, first of all?
Busy emergency department with multiple admissions.
Okay, what's the question?
What is a mandated reporting item?
Yes, which things are mandatory reporting? Okay, gunshot wound,
I'm thinking yes.
Yes.
absolutely. A client who has pertussis. Yes. Why? It's community required, right? It's community risk. Mandatory reporting. Number 3, a child with cigarette burns.
Yes.
Why?
Child.
Could be abuse, right? Could be abuse. A vulnerable adult who is emaciated.
Yes.
Why? Could be abuse. A client, an adult client who has fallen and broken a hip. No. That one wasn't as hard, was it? What did you have to know to answer that question? What is a mandatory reporting incident, right? Sometimes you're going to know the information. Sometimes you're not going to know all the information. You have to make judgments. Those get hard. Okay, let's try another one. The nurse manager is discussing facility protocol in the event of a tornado with the staff. Which instruction should the manager include in the discussion? What is the STEM?
Discussing protocol.
Discussing protocol for what? For a tornado. Okay. And they're talking to who? With the staff. Okay. And who's doing it?
The nurse.
Okay, so the manager's having a discussion with the staff about what is the facility protocol in the event of a tornado. I like to put it in my own words so I understood what it said. Okay? What is the query or the question?
What instructions should they include in the discussion?
So what? What to tell them? What should I tell the staff? All right? Put yourself in that situation, you're the manager. Or maybe you want to put yourself in the situation and you're the staff. What do you need to know? Okay? This is a select all that applies, so what's the first thing we do? Cover up all the answers and look at them one at a time, right? And what do they all have to do? They all have to be completely, each one, when we look at it, has to be completely true, has to match the STEM, and it has to answer the question. Okay. Open doors to the client room.
Because you're gonna do that anyway.
Is that true?
No.
Well, we don't know.
Anybody know? Anybody work in this facility that has tornado protocol? They close all the doors. They close them. So number 1's not true because we don't open doors. We close doors. Move the beds away from the windows.
Yes.
Absolutely. Is it completely true? Is it something you need to tell them about tornado protocol? Absolutely. So far we need number 2, right? Close the windows and the shades.
Yes.
Absolutely. Is it true?
Yes.
Yes. Is it something they need to know?
Yes.
Absolutely. Put blankets over the clients who are confined to bed. Yes. Why do we have stupid blankets all over the place leaning on the rails whenever it's tornado season, right? Yes. relocate ambulatory clients from the hallways back to their rooms. No, that's backwards.
I'm just gonna
Yeah.
say,
That's
don't you
backwards.
move them to the tornado space, like the
Correct.
designated tornado area?
Correct.
Okay.
But we certainly aren't gonna relocate them back to their hallways in the event of a tornado. Back from the hallways to their rooms. So in other words, if they're out walking around, they're sending to their rooms right now. Because there's a tornado. Nope. Okay. So, focus on the subject of the STEM, okay? And then go through each individual one and say, is it true or is it false? And evaluate them individually. Are they easy? Hardly ever. Sometimes. Here's another one. The nurse manager is evaluating a new nurse's time management skills. Which statements made by the new nurse would demonstrate acceptable time management? Okay, so what's the STEM?
Evaluation of time management skills.
And who's being evaluated? The new nurse. What is the question?
Demonstrating acceptable time management.
Who?
The nurse. The
The
new nurse.
So these are going to be responses by who?
The new nurse.
The new nurse. This is a type of question that's often missed. Because students will read that question and they'll say, well, they'll be thinking in terms of the manager instead of the new nurse. Okay? All right, so select all that apply. One at a time. Does it match the STEM? Does it answer the question? I'm late in getting the client ready for radiology because I had to answer some questions from a family member during the client's discharge.
No.
Does that demonstrate acceptable time management? Nope.
Prioritization.
Everybody's got delays. Okay. However, I did not clock out on time because I needed to wait until the end of the shift to document all nursing care provided today.
No.
No.
Now, first of all, you're not going to wait till the end of the day if you don't have to. Number 3. I did not clock out on time because I admitted the client who came 30 minutes before the end of my shift.
Yes.
Yes.
Absolutely, because what's your priority, right? Patient. Number 1, I'm late in getting to the client ready for radiology because I had to answer some questions from a family member during a client's discharge.
Did you need to go back to the beginning?
Yeah, I did. What is happening with this time management? What's the priority? Do you think this is about the same patient? When you read that? You're shaking your head. Tell me, Olivia. What's happening in that selection, number 1?
It sounds like it's two different patients.
I agree with you. I think it is 2 different patients. One patient is doing what?
Radiology.
Going to radiology. What's the second patient doing?
Leaving.
Being discharged. And you were late getting one patient to radiology because you were answering questions from a family member during another patient's discharge. Is that an acceptable time management situation? It's real life. Which one is more important?
Educating during discharge.
Educating or radiology?
Probably depends on what radiology exam it is. 'Cause is
Yeah,
it chest
I agree
X-ray?
with you.
But isn't that kind of reading into it?
You're late getting one client ready for radiology because you're answering questions about a discharge. Just saying. Did not clock out on time because I admitted the client who came 30 minutes before. Okay, we did that one. I made morning rounds on all my clients today before passing medications and starting treatments to be completed during my shift. Is that acceptable?
Depends on what kind of meds it is.
That is correct. That is correct. What are morning rounds?
They're with your physician and, are they?
Not necessarily,
It's the handoff time.
It's, yeah,
maybe.
it's when you do your own assessment on the patient, right?
Not necessarily.
Or you could be doing your bedside rounding with the off-floor machine,
When you go on the floor, what's the first thing you're gonna do?
rounding the patient.
What does that mean?
Check in, make sure everything.
Do you know why you're having trouble with this? Because you're thinking about prioritizing. Okay? And you don't really have all the information that you need so far. But you're starting to prioritize and you're realizing, oh wait, I can't make this decision because I don't have enough information. Okay? Making rounds on your patient in the morning might be as simple as looking in the door and making sure that they're breathing and they're sleeping or they're not on the floor. It could mean a lot of things. It could mean making rounds with the nurse, bedside report. Who knows? It could be making rounds with the doctor. Okay, let's look at the next one. I'm late performing a dressing change because my breaks are usually scheduled early, so I eat breakfast right after I begin my shift.
No.
Absolutely, that is not about your patient. Yes, ma'am.
So, what did we ever figure out for number one? Or does that one apply or no?
Well, you've always got changing client environment. During the course of your day, your priorities are constantly going to be changing because of where you are and what you're doing, and your clients are always changing, and you may have 4 or 5 of them, and it's always changing. Okay, and they're all always changing. So, you may have to delay that radiology because you were in the middle of a discharge. Yes, sir.
Didn't you delegate that out though?
Oh, maybe you could. Good thinking. I'm not giving you right and wrong answers here. I'm making you think. Do you see how you're looking at lots and lots of different priorities?
The NCLEX and how do they decide who's right and who's wrong?
Good question.
I feel like that's kind of right.
Oh, yeah, it's tough.
I feel like some of these examples.
I feel like this is why you're going to be learning about prioritization. You're going to be learning about those medications. You're going to be learning about those different procedures that these are all things that you're constantly, you're only in week 2 of nursing school. You're okay with not knowing the answers to these yet. Okay? We're working on it. But this is why I want you to download that API app onto your phone and start doing practice questions. Because it's not as much about what you have for an answer to that question right now as it is about reading the rationale behind the answer they gave you. So for example, when you look at this question, the rationale that they gave me. Number 1 says, due to factors of a constantly changing client care environment, individual components of care might be delayed. They might be. So number 1 could be true. Number 2, documentation needs to be done as soon as possible. That's not acceptable. Throw that one out. Number 3, due to factors of constantly changing client care environment. Oh, did you hear that before? Yes. Nurses may not finish their assigned shift on time. You can't go home just because the clock struck 6. Okay? So, yes, number 3 is correct. You didn't clock out on time because you weren't done. Because things constantly change during the day. You make a plan, you have the plan in your hand, and it's probably going to change 70 times before the day's over. But you had a plan. And your priorities are constantly changing because they don't stay the same. Because people don't stay the same. And by the way, you got 3 admissions and 2 dismissals, and 1 patient crumped and you had to send him to the ICU, and you had another patient that passed away, so you had to do end-of-life cares, and none of that was on your plan at the beginning of the day. Okay? Prioritization is ever changing. Just like your prioritization plan for survival in nursing school. Your kid got sick, and somebody has to stay home with them, but you've got clinicals today. So what's my plan? And what's my backup plan? And what's the backup to the backup? Because you're going to need it. Number 4, making rounds on all your clients is acceptable as long as treatments and medications aren't late, right? There's no indication that treatments and medications were late in this question. It doesn't say that they were late. It doesn't say that. Don't read it in. Number 5. That's not an appropriate rationale for time management. Breakfast, eat that before you come to work. Oh yeah, you had to get up 30 minutes earlier to do it, but do it before you come to work. It's not okay to not do your dressing change because your breaks and your lunch didn't work out. Plan it. Okay? One answer at a time, don't read into it. The CNA is assisting in the pre-operative preparation of the client. Which task should the nurse delegate to the CNA? Select all that apply. Insert the NG tube.
No.
Nope. Beyond the scope of practice. Which tasks can be delegated to the CNA? Obtaining vital signs. Yep. Recording output from emptying a urinary bag.
Yes.
Completing the post-op checklist. Nope. Witnessing the client's signature on an operative consent form. Nope. How come those were so easy for you? You know those things already, right? You're going to know the other things. But you're going to put in those 3 hours for every hour you're in class, and you're going to keep doing practice questions because it's going to help you start thinking like a nurse. You're really good at thinking like a CNA because you're really good CNAs. One of the big hurdles of nursing school is moving past thinking like a CNA to thinking like a nurse. Because it's easy to think like a CNA because you're used to it and you're comfortable with it. Now you've got to make a big jump to thinking like the nurse.
That's very black and white though, too.
Oh, that's because it's black and white in your brain. Before you were a CNA, you didn't know what you could do and what you couldn't do. Now you do. Okay. Gonna skip through some stuff pretty quickly here. So, NCLEX testing strategies are about prioritizing information. Think about what we talked about today. Maslow started with the basic stuff. Food, air, water, shelter, sleep, the things you gotta have. And he moves up and up and up to more difficult or more higher priority things, or less prioritization. Safety, love and belonging, esteem, and number 1, the desire to become the most that you can be. Okay, so we start with basic stuff. You gotta have air and water, ABC, right? ABC and pain. Then comes safety. Then comes the education and the psychological stuff. So prioritization can be, there's lots of models for looking at prioritization. Okay, the book offers you Maslow. We're always talking about Maslow in nursing school. Go to Bloom's taxonomy and look at the video. There's about 50,000 Bloom's taxonomy videos. Just watch 1 or 2 to get the idea. It's all about prioritization, and one will do it for you. Okay, but move yourself away. Move it there. The client's returned from the nursing unit following a total laryngectomy. Oh my God, I don't know what a laryngectomy is yet, right? but they just came back to the unit following a total laryngectomy. Which observation by the nurse requires the most immediate intervention? Client can't speak. They're coughing up blood-tinged sputum. Their O2 is 82%, or their wound drain is half full.
Oxygen.
A is about airway. That's prioritization 1. Which one of those answers about airway? Number 3. Actually, number 1 is kind of about airway.
After getting your
Maybe, maybe not.
Well, if it tells you that they have laryngectomy.
Yeah.
Expect them not
Don't know what an laryngectomy is yet, right? But maybe you do. Okay. But number 2 is definitely a bad thing. And if they're unable to speak, it might be because their airway's closing. But in this case, that O2 level of 82 is a definite. 1 is a probably. It's okay, but the best answer is which one? 3. 7:30, an oncoming shift nurse is planning care for 4 clients. Which client should the nurse plan to assess first? 23-year-old with cystic fibrosis who has pulmonary function test in 30 minutes. A 35-year-old admitted the previous day with pneumonia and a temperature of 101. A 46-year-old who has a chest tube removed an hour ago and they now have dyspnea. Which means what?
shortness of breath.
Oh, you're good. 77-year-old client with TB who has 4 anti-tubercular meds due at 8 o'clock. Which one's the most important? Why? Airway. A, B, C. A, B, C. Then what? Pain. Then what? Probably safety. Then what? Education. Get those priorities. An adult client is newly admitted to the PACU from surgery. Which assessment finding should the nurse be the nurse's priority? Surgical side with a scant amount of blood. A client sleeping but easily aroused when touched. A client with respirations of 6 to 8 per minute. A client's blood pressure 5 minutes ago was 110/68.
3.
3 is pretty bad. And that comes right before the bad's really bad. Okay. Yeah, 6 to 8, not good. 2-year-old child in an urgent care situation with blistering burns due to sun exposure. Following an initial assessment, which action should be your priority? Determine the percent of burn injury, administer an analgesic medication, open the blisters for debridement, or apply cool compresses. Why? You've got to deal with the pain. Who cares what percentage is if you can't get the pain under control? And they didn't even give you anything about airway or breathing or anything like that. Probably because it's sun, but there you go. You'll learn about burns. You see how you're prioritizing A, B, C. It gets easier. It will get easier. But you've got to start thinking like the NCLEX questioning people. Okay? I was going to give you a Kahoot, but we're out of time. I will pass this Kahoot on to someone who you have tomorrow. Who do you have tomorrow? Don and Barb. Don and Barb, I'll give it to them. And they can give it to you. It's about NCLEX test questions, and it gives you 10 NCLEX questions, and it lets you answer the questions and then measure. Okay? I will pass it on to them.